Hello everyone, welcome back to my channel, and today we are going to talk about idiopathic thrombocytopenic purpura, and we'll try to understand what exactly it is, what is the pathology of this whole clinical condition, what are the causes, how do the patient present, so the clinical features, what investigations to go for, and then of course the treatment. And then I'm going to add on to homeopathic list of remedies that work wonderfully in these cases. So to begin with, idiopathic thrombocytopenic purpura is actually an autoimmune disorder. So what happens is that the body starts to produce antibodies against platelets. So isolated platelets get reduced in our body. Hemoglobin remains normal, the TLC remains normal, but the antibody starts to produce against platelets. Now, normally, let's talk of the pathological part of this idiopathic thrombocytopenic purpura. Normally, if this is a platelet, they have receptors. These receptors are called as GP2B or GP2A receptors, which are present on the surface of the platelets. So if this is a one platelet, this is another platelet, the fibrin, it attaches itself to these receptors. At these receptors, the fibrin attaches, and that is how clot formation occurs. So these receptors are really important. Now, what happens in cases of idiopathic thrombocytopenic purpura? The platelets having the receptors are attacked by these antibodies. Let's say this is the antibody, and then all of a sudden a macrophage comes and engulfs this platelet. Okay, so this is the antibody and this is the macrophage. So platelets are engulfed by macrophages and then they are destroyed in the spleen. Okay, so obviously with that you can understand that the treatment has to look after macrophages in order to prevent them from engulfing the platelets, and then sometimes even splenectomy has to be done. Right. Now let's talk of the causes of ITP. Now, in case of children, majority of the times it's idiopathic. But if the cases come in the age group adults, sometimes there could be secondary causes that we need to rule out. Most common of them is SLE. Other infections like HIV, leukemias, and lymphoma. Now, what are the clinical features? In mild cases, of course, the patient will have bleeding tendencies. So they may come to you with epistaxis or oral bleeds and then purpura. In severe cases, they may have GI bleed and dysfunctional uterine bleeding. Now, when we see pediatric cases, they will abruptly present with symptoms. Sometimes, if they have fever, let's say viral fever, about 2 to 3 weeks later, suddenly their platelets will go down less than 20,000, and then they may land up with such bleedings. In case of adults, usually it is of slow onset, and we might not get a history of fever, and platelets can range up to 20,000 to 80,000. And usually spleen and lymph nodes are not enlarged on examination, but they will present with those clinical features of bleeding. Now, let us discuss what investigations we need to go for. The best initial investigation to be advised is CBC and peripheral blood film, where we will see that the RBCs will be normal, TLC will be normal, but thrombocytopenia will be evident, and we can see giant platelets on peripheral blood film. We can also go for another investigation, which is bone marrow examination. Here, megakaryocyte can be seen. Ultrasound of the patient will generally remain normal, but in order to confirm ITP, you can go for antibody checkup for GP2B and GP3A receptors. This will confirm that this is a case of ITP. Now, coming to the treatment, of course, we need to see the range of platelets. If there is no bleeding and the platelets are more than 50,000, generally no treatment is required. But if there is a mild bleeding and the platelets are in the range of 20,000 to 50,000, sometimes the treatment needs to be started. In case of severe bleeding, such as GI bleeding or excessive DUB, and the platelets are under 20,000, then intravenous immunoglobulins have to be given. If recurrence is seen of the episodes, splenectomy is also done. Right. So this is a conventional setup of treatment, but since I'm a homeopath, I will give more stress on what homeopathic remedies we have for bleeding disorders like this. So just to give the list of remedies, of course, it depends on the presentation of the case, what are the individual symptoms, what are the modalities, what is the type of hemorrhage. All of it will decide the remedy, but the list is long. Some of it I'm going to describe: aconite, arnica, baptisia, belladonna, carbovec, China sulph, Crotalus horridus, Hamamelis, lachesis, Merxol, acid phosphorus, salicylic acid, Secal core, terebinth, Veratrum viridi. So a long list and many more remedies actually. So go in details and try to find out, and you shall be able to manage cases of idiopathic thrombocytopenic purpura well. Thank you so much for watching the channel. Please do subscribe and share with the colleagues in order to really go and revise and reread and learn more and more. Thank you so much.